What you're looking at now is a cervical spine. That's your neck. That yellow that you see with those lines transmitting through is the spinal cord. What's not talked about with other doctors, what I found when I talk to patients, is your spine houses the spinal cord. Now that spinal cord literally sends nerve signals from the brain down the spinal cord through the nerves to every single cell, tissue, organ in your body. What's also not talked about is that your spinal alignment literally has direct impact on how that spinal cord functions. When you looked at this, I'm going to play it again for you so you can see, starting all over, is that when you look at the spine, this is what a normal curve should be. Now, when you look at it, you see the spinal cord. You see how it's sending messages out. Now, notice the spine is changing. That's going from lordosis to kyphosis. A cervical kyphosis is terrible for your health. Why? This is what is not explained enough, is that literally, you imagine the spinal cord, it's in a nice relaxed position, and then when your spine shifts, it's like bending it like that. And when you bend it, imagine like you had like a steel bar and you're bending it to the opposite side. It literally starts to stretch and pull. Maybe a rubber band, you stretch and pull it. That's going to put tension on that spinal cord. That is vital for your health because now you're going to have decreased nerve signals. And when that happens, that's when health goes down. Now, what I talk about is that. I talk about how your spine is important for your health. I'm going to talk about how your alignment can directly impact your health. I'm going to talk about the spinal cord function. And I'm also going to take x-rays and literally biomechanically analyze every single part of your spine to see if where those misalignments called subluxations are and how that's affecting you. So when you look at this, I take x-rays on patients. They have no idea their spine looks like this. They've never had a doctor talk to them about the spinal cord, their alignment, and how it relates to their health. And then when I analyze it and I go over it with them, I show them that the reversal of your neck curve is directly impacting your health. Now, when patients don't come to me first, this is what I hear. I've been to another chiropractor, they didn't take x-rays. They just got me adjusted and I felt better, but it came right back. I've also heard that patients go to either a primary care doctor and they just get diagnosed with neck pain or maybe pain down to the arms or numbness or tingling or headaches. And then what they do, well, here's a medication for that to cover it up. Maybe they'll go to an orthopedic doctor, they'll take some x-rays. They'll say that you have degeneration, which is normal for your age, which I want to stop and say this. It's not normal for your age. It's normal for anyone's spine that's misaligned. And the reason why is because when you have these misalignments, you've changed the whole structure of your spine. Your body will then start to degenerate at a faster rate due to having abnormal loads, stress, and strain. And these are biomechanical principles. They're not talked about by other doctors. Why? I'm not sure. But guess what? That's what I'm going to talk about with every single patient that comes in here, and including yourself if you're listening to this and want to come into this office. Now, when you go to these other doctors, they're going to say, okay, we can do an injection to the area, maybe the joint or around the disc, to decrease inflammation. The thing is, it's not going to fix that. This is the issue, the misalignment of the spine. So what happens? You may get relief. That may last 3 months. But guess what? That didn't get fixed. Your spine's going to keep degenerating at a faster rate. Your spinal cord's going to still have decreased nerve signals. And then it comes right back. You go back to the orthopedist. They may say, let's get an MRI. They're going to confirm the findings that your discs are degenerated. You may have a bulge in your disc that's starting to literally either pinch on a nerve or cause inflammation around the nerve, causing either issues down to the arm, to the head, or extreme pain syndromes. So then maybe do a round of physical therapy, which is great, but it's not going to change this alignment. You may feel better, you may not. You go through this whole entire cycle while nobody has corrected this and nobody has looked at actually the cause of your issues. And then lastly, what I hear from patients is then the threat of surgery. They've done their bouts of traditional type of care. They've had the MRI, they've done some injections, you've done some traditional type of care, whether it's from a chiropractor, whether you're a physical therapist or other types of therapists, and you're still having these issues. And then you're scared, you're worried that you have to have the surgery, it's the only option. I want to tell you this. It's not the only option. You don't have to go through surgery. At least you can try something different. What I do is so different. Now, I wish it wasn't. I wish that every single chiropractor would utilize x-rays, would biomechanically assess the spine. I wish that. The truth is that most don't. Even if you just look around the area of where I practice in Alpharetta, most chiropractors do not practice chiropractic biophysics. They're not going to take x-rays, biomechanically assess the spine, and most importantly, come up with methods to actually correct the alignment of the spine, which is the cause of your issues. That is what I do. And before you go into surgery, before you go through this whole entire bout of what I just said earlier, you can at least either message me directly, you can leave a comment, you can call the office, you can visit our website, which is listed as well at optimalspineandbody.com, and you can just learn more. You can call me. I'll even set up a time to talk with you directly if that works better for you. You can come into the office and I'll just set up a time to talk with you. I'm here to help you in the best way I can because I can offer something different.